This is Lorena Mora-Mowry from Ohio Latino Today. Today we have a Dr. Elena Ríos. She's the CEO of the National Hispanic Medical Association. Welcome to Ohio
Thank
and
you.
Columbus. Can you please share with us a little bit about you? Because we were very moved with your story about your mom and your dad. But can you please tell us a little bit about that so we can, you can learn what we heard this morning?
Well, I think what's important is that I come from California, and my parents, my grandparents came from Mexico. And like many of our families, they were immigrants and had that immigrant spirit. And my parents were both born and raised in the Los Angeles area. When my father's father, my grandfather, my paternal grandfather, died in a train accident because he worked for the railroads, his family was kicked out of the railroad housing. And they had to get a house, and they ended up being living across the street from my mother, and that's how they met. But I think what was important is that my father was 17 years old and had to become the head of his family. So my father learned how to take care of his younger brothers and sisters and started working right away, and he became a factory worker, and then they sent him to school and he became a machinist, a skilled laborer. My mother gave up her college scholarship that she got in the 1950s and got married, and I'm the oldest of 5 kids. And I think what was important about my mother's upbringing of us was she made us want to learn. She took us to the libraries, and we always got books and we read, and she took us to museums. And anyway, my mother actually became a nurse. She studied in the local community college. When I was in high school, she started going to school after the youngest of 5, my youngest brother, the only boy, and we have 4 sisters and a brother. And so she became a nurse, and I met the doctors and nurses in the local community hospital because she got me a job there when I was a senior in high school. So it was important for me to realize how important work ethic was, and studying and academics. And then for myself, and I told the story, I always loved learning, and I was very good with science and math, and actually I won a math scholarship to be able to go to college because my parents couldn't afford, to go to high school. So I went to an all-girls Catholic high school. My parents would never have been able to afford that, and it was because I went to the Sacred Heart of Mary in Montebello, California, that I was able to get college courses and ended up at Stanford University in 1973.
Tell me about that experience in college and how that solidarity of working together inspired what you are today.
Well, at Stanford University, like many private schools, there was more money given to the minority students. When I started college in 1973, I met the first class of Hispanic students, and mainly Mexican American, because Stanford would recruit in California and Texas, but a few Puerto Ricans and from New York. The first class was only 50 students, and it was an experiment. 50 Hispanic students, 50 African American students, and they were the seniors when I got in, and they had been part of the Vietnam War movement. When I got to college, we were more about building the culture in school, at the university. So we had a Cinco de Mayo events, we had Our Lady of Guadalupe events, we had our Chicano graduation, and we all called ourselves Chicanos. But we all wanted to work together to take pride in our culture and not to have our own family at the school, because so many of us came from poor families or middle-class families, and we weren't part of the rich people that lived in the fraternities or sororities, right? And we also had a president and a vice president for Chicano Affairs, a vice president for African American Affairs, and we had cultural theme houses where we had our clubs. We had student clubs to help mentor the local high school students. And I actually had my work-study job. I created an organizational project called Project Motivation that I got from a friend of mine from UCLA. And we brought students from East Palo Alto and East San Jose, African and African and Latino students from the poor parts around Palo Alto, where Stanford is a very rich neighborhood, but there are poor places, Redwood City, East Palo Alto, East San Jose, and we brought them in to Stanford to show them what a college campus was all about. And so that's where I started learning, and I also was part of the executive committee of the vice president for Chicano Affairs, Cecilia Burciaga, who was probably my first mentor. She came from Washington, D.C., her and her husband. And I think what was also interesting about Stanford to me was the network of good friends that I started, and I still have friends that I have remained in contact because we knew that we all had a very special reason for being at Stanford, and that was to do the best we could with our academic and intellectual curiosity to be able to help our communities, and that we wanted to go back and do something in the future that would help our communities get better. And I was pre-med student from the beginning, but I majored in public administration, human biology and public administration. And during my junior year, summer, I went to Washington, D.C. as an intern. And that's where I found out that I wanted to be back in Washington, D.C. at some point, and I decided that instead of just going to medical school, I would go to public health school and go into policy. So all of that happened when I was in college at Stanford. And I also learned how important it was for me to understand that if you're going to get involved in organizations and you want to make changes, you have to be at the top, and you have to understand the control and the power issues. Not that I understood what that meant, but I understood that you have to be able to understand how to make changes. And so the networking and how to make changes, the idea of policy change just became very part of, that's what I learned as a college student.
What do you think will be the challenges of today's students, Latinos, that they are more diverse in Washington, in their careers, in their lives?
Well, first of all, we created an organization, the National Hispanic Medical Association, and now on our board of directors, it was all just Hispanic doctors talking to each other, and we said, no, we can't do that. 50% now are the Hispanic doctors. The other 50% are insurance companies, pharma companies. Mm-hmm. So you need the support from within your discipline of where you can get resources. So they're on our boards. But we also decided we needed to have a way to mentor the next generation. So on our board we created a council of young physicians. We have that chairman, a council of residents, and we have the Latino Medical Student Association, which is a separate organization that I also founded with other people along the way. Yeah. That happened in 1987 when I was finishing medical school. We started a national Latino medical student group. So the National Hispanic Medical Association becomes a way for each level of your life, as you go from one undergraduate student to graduate student, which is called medical school, to resident. You're still a student, but then when you finish residency, you're right out of residency and you're just a young doctor and don't know what to do either. So we have mentoring and leadership development all the way up. And so I think for the next generation of students, and in our organization it's been 20 years, we've seen the students who were students are now doctors, and they've stayed with the organization. So I think what's important is that we need to let more students know that we exist, so that those that are in health can have a place to find others that they could share ideas with, maybe work with, socialize with, that kind of thing, and get mentored. And even if they're not doctors, we have many members who are not doctors. They're in public health, they're in policy, they may be teachers, they're on faculty at universities, or they work in clinics or hospitals. And many of our members are clinicians interested in public health and policy. So I think we need to work together to let more know about us. And we have regional events, so that I think that's something that we need to do for them. And I really think, this is me, I really think that we need to go to the colleges and have a linkage for those Latinos interested in science and math Even if they don't become a doctor, they go into healthcare to motivate them to keep on track, because there's so few of us, and it's so hard. It's so hard to be disciplined, that you need the role models and you need the mentors to keep the students going, that the Latino students that made it into college.
Doctor, you started this organization 20 years ago. What you have learned and what needs to be done?
Well, what I learned was that it was needed. It was about time. You know, the nurses had an the Hispanic nurses had their organization since the 1970s. The Hispanic dentists started in the 1980s. We didn't start until 1993, 94 because we were a part of the White House, and the first White House to develop healthcare reform, the Clinton White House, and there was a need for us to find Hispanic doctors who could be part of policy and policy making, and that's why we started the organization, because we knew that we had the commitment and the interest, and we're all leaders. The doctors in our organization are leaders because they are already helping build their hospitals or build programs in their communities, but what they didn't know was that they could be leaders at the national level. And so to have an organization that is just a facilitator, we're just helping all the doctors come that are interested in coming to the national level. And now we're going to help doctors come to the state level and the regional level, because we believe changes need to be made at the state level now. And that's where we're headed. So what I've learned is that if you build programs, there will be people who are interested. You just have to find the right people. So we built our NHMA Leadership Fellowship and had leaders who came and said, I want to learn more about being a higher level leader, and how can I do more to help my community. And that's really, our mission is just to improve the health of Latinos and other underserved.
That cultural health, tell us about that.
Well, that just means that in our communities, health care is all about having services at a hospital or a clinic or at a doctor's office or a dentist's office. But the real change that needs to happen for a society to be healthy is in the community. Before you get sick and have to go to the doctor's office, you should be having a healthy life. So we call it having a culture of health, means that every single institution, whether it's the schools or the churches or the businesses that we work in, all the different institutions in our community, the transportation, the child care, everything should include a way to educate their constituents about being healthy, from little children all the way up to adults, so that we all know about health. We all know how to avoid getting the diabetes and the heart disease by having more nutritious food, and how to have more farmers markets, and how to have more physical activity. And we should all be outside playing like I grew up, but because of computers and videos now, we don't have that sense of physical activity anymore. So anyway, that's what the culture of health is. And for the policy world, that just means that we need health in all policies. There should be health in housing policies, there should be health in the transportation policies. When we're working on climate change and the importance of environmental health. And so it's just health everywhere.
You would like to share a message for the Ohio Latino community, for the Midwest?
Just that I think that the Ohio Latino Health Commission, or I shouldn't say that, the Ohio Latino Commission is so important to serving as a way to gather the best practices and to share the strategies, because the Latino community, no matter where you're at, and especially in a state like Ohio where you have similar policies to deal with, similar situations to deal with, that you need to share best practices so that everybody doesn't work in a vacuum, and that you work together. So I think it's great that you already have your Latino leaders that are networked across the state, and I think there's going to be many opportunities for healthcare reform in the future, like I said, at the state level, to help make changes for the Medicaid and for the homeless and for the prison population, for the medical students and the nursing students here at Ohio State and other places, and the colleges, and there's just so many things that you can do just to help your own state. And we'd be happy to work with you.
As a Latina woman, do you have a special message for all of us?
Well, I think it's just so important to be, to have a goal and to go with it and not let anybody get in your way. And I think it's important that we build a sense of being true to our own goals. I think that's what's important, and that we can do anything we want to.
Well, she only inspired all of us, inspired me to continue doing my work. Thank you, doctor. Thank you so much.
Oh, thank you.